Welcome to What Would Larry Do? I am Dr. Ann Watwood, and I am here with Larry Hellwig this morning.
Good morning.
Good morning. How are you?
I'm good.
It's Friday. It's November. It's, we're cruising along through the holidays, and we've got some fun topics for you guys today. So our first topic, believe it or not, is going to be one of our black sheep topics that I feel like people don't want to talk about a lot, but it is everywhere. So we're going to talk about incontinence today.
Oh, yay. It's like, yeah, I wet myself. Wow.
He says that, but yet he is super passionate about this and the technology. And there's a lot of different options out there. We'll get into what, the huge marketing and thing like that. But first, Larry, tell us a little bit about Emsella that we're going to talk about that is this amazing treatment for incontinence.
Yeah, we have a device called Emsella. It's a chair that you sit in, watch television. It's easy. And that chair uses what's called high-fem technology. And high-fem stands for high-intensity focused electromagnetic. And so if you think about going to an MRI, that's high-fem technology, but it's not focused. This is focused. So it's actually a magnet in the chair that is developing all of the energy, and it sends the energy up in the form of magnetic energy. And what you get out of it is very simple, contractions. Mm-hmm. You get 11,200 contractions in 28 minutes. And that's using high-fem technology, and it does not hurt. It's just, we always say, just sit on the chair. It's all you have to do, and let the chair do the work. Just sit there, relax. It is not painful. It does not hurt. I'll be honest, it feels weird. Don't you think?
Well, yes, but let me wind you back. What do you mean by contractions, Larry?
Okay. Kegels.
Yes, so there we go.
Yes, okay. So
because most people down there are like, contractions? What do you mean contractions? Right, yeah. I don't want to have another baby.
Well, it is the Kegel throne.
Yes.
So you sit on it, and it does it for you. And, it does 11,200. When was the last time you did 11,000 Kegels? I mean, really? No one does it.
No, I don't think I've ever done them in my life. And they're running that video through that was talking about it as the Kegel throne. But right. 11,200 Kegels in 28 minutes?
Yes. I mean, are you doing Kegels now?
No, I'm not.
I'm just checking.
I know.
Yeah.
He likes to imagine that every time we're here, I'm sitting here doing my Kegels for the day so that I don't have to go in and sit on the chair. But I'm not going to lie, it's a lot easier just to sit on the Emsella.
So if you've talked to your OBGYN recently, they will tell you need to do a minimum of 100 Kegels a day. Mm-hmm. When we talk to our patients, are you doing them? No, not happening. I mean, no one's doing it. And they always make it sound so easy. You're sitting at a stoplight, do your Kegels. You're on the telephone, sitting around, do the Kegels. I mean, it sounds easy. It just doesn't happen. That's part of the problem.
No, it's
and the other part of the problem is not everyone knows how to do it.
No, and it's one more thing that women have to do. Like, really? We have to sit here and now exercise our pelvic floor on our way to work?
Well, that is. The pelvic floor is such a critical component in your overall well-being. Mm-hmm. And we do talk about sexual well-being, and we'll get into that aspect of it as well. But, if you think about when we talk at our office, core to floor, we're talking about the abdomen, we're talking about the entire pelvic floor, all the muscles of the pelvic floor, and we're talking about the glutes, all the muscles of the buttocks, thighs, everything, because that really makes up the entire core to floor program. Mm-hmm. And wow, what a difference that makes for patients.
Oh, yeah, so. I absolutely agree. And then a lot of people, as they are aging, are really not thinking about their pelvic floor. They're not thinking about incontinence. And we'll start to get into here, what incontinence is, what causes it, all that kind of stuff. But it is a huge issue. Once we actually give the statistics of how many women and men have incontinence, how much money is being spent per year for incontinence, it kind of blows my mind that, you know, more people are not seeking out the Emsella on a regular basis. But the fact of the matter is, I bet most people don't know about it.
Well, that's part of it. And the other part of it, too, is I think psychologically, people tend to normalize things. You know, it's like, well, my mom had incontinence,
Yes.
so it's normal. You know, it's my friend has it, my sister has incontinence. And so they don't think, oh, I should do something about this. They just normalize it. Well, it's normal, and so I'm going to go out like everybody else and buy pads or take very expensive medications or what have you,
Yeah.
you know, that type of thing. And so many times it kind of gets pushed to the side as being not that big a deal, when the reality is, if you're having to change pads or wear, you know, adult diapers and things like that, it's changing your life. And it's changing it significantly, and you should be thinking about, well, if I don't have to go, what was my life like when I didn't have to do all this?
Yeah.
And you got to go back to that.
And if it's something as simple as rebuilding the pelvic floor that's been damaged, that you can come in and sit on a chair, there's no downtime, it's not invasive, it's an easy treatment to have done. Exactly like Larry said, it looks like a little throne, you sit on it, and literally you read a book, you watch the movies that are on our TV. It's the easiest treatment that we have in our office. And it does feel a little weird, but to be honest, not that weird. Once you've done it once, you're like, oh yeah, this is so easy to do. People just flock to it. But one of the things when you were saying normalizing it, I was at an office training on Monday night and I had to sneeze. So I was like, oh, hold on a minute. I got to sneeze. You know, I just stepped aside because COVID, everything. I don't want to sneeze in somebody's face. And once I sneezed, because I sneezed really loud, she's like, well, at least you didn't pee yourself when you sneezed. I was like, well, we do have the Emsella, so, you know, I don't have that problem. But it was funny because it was 3 of us women in there, and that's the first thing that came out of her mouth.
So if you're seeing what's on the screen right now, that is so real to so many people. You know, it's it. You know, you don't think about it when you're young. It's kind of funny. Your mom crosses her legs every time she sneezes or coughs or what have you. And so, of course, you laugh about it because you think, well, otherwise she's going to wet her pants.
Yeah.
And as you get older, obviously, it's not so funny anymore.
No.
And that's the fact. That's the truth of it. And there's just lots of causes for this.
Yeah. Well, and it's not just sneezing, it's laughing, it's running, it's jumping on a trampoline. The amount of women I've met that it's like if they have a trampoline with their kids in the backyard, they will not get on the trampoline. Absolutely, because they know that if they start jumping around on that thing, they're going to pee themselves.
Right.
And that's something that's very simple. And then I start thinking about, well, there's all these CrossFit gyms and there's all this different stuff that's out there that requires running and jumping. And these women are now trying to figure out, do I wear a pad when I go? What do I do about it? So first, Larry, let's kind of dive in. What causes incontinence?
Who knows?
Stop it. Oh my gosh.
It's a mystery. No, it's pretty straightforward. Obviously, pregnancy. You know, I mean, you're carrying around this fetus, this baby, for 9 months. Your entire abdomen, your abdominal pressure, everything is changing during that time. Everything is being stretched. And then you deliver the baby. Well, you know, some people will have natural childbirth. Other folks will have
C-section.
You know, C-sections and what have you. But no matter what, there's additional pressure that has been in that area for a long time.
Yes.
And that's going to cause all kinds of problems. So I think that's the beginning.
Yeah.
Yeah.
Well, for sure, you know, definitely the stress incontinence can be number one is childbirth. And it could be from one child. It could be from 6 children. I've seen women in both aspects where some of them have it immediately after their first child. They're 33 years old and now here they have incontinence. I've seen other ones that have been fine and boom, number 5 comes along and they're like, oh, yep, now this is going to be real bad. Yep. And so that's a huge thing that goes into that.
Well, the other thing, of course, is aging. That's another, you know, as you age, and being now old like I am, everything changes. You know, I mean, the minute you hit, a lot of people say, oh, when I hit 40, my skin, everything started to fall, this. Well, I find that when I hit 50, really my eyesight, my this, my that, everything started changing. And so, the aging process is not kind, and aging is not for wimps. I mean, shit, you've got to, suck it up and fight that process, because there's nothing easy about the aging process. And you're either going to just roll over and let it happen and deal with all the consequences, or you're going to man up, so to speak, and say, okay, this is a problem. What am I going to do about it? And so that's part of it. And then with the aging process is menopause. I'm so happy I don't go through menopause. It's like, really.
You're trying to act like you're not going through andropause, though. Men go through it too.
Yeah.
They just don't admit to it.
Hence the new car.
That was your andropause, was your Maserati? Going to get you through your rough part of life?
Yeah, just sometimes you have to make changes. So things happen, but I think the important thing to remember is a lot of this stuff is going on, you're not thinking about it, and all of a sudden, there it is. It's like, crap, now what? Well, if you know that there are ways to be able to treat it and to combat it, and it doesn't have to be difficult, and I have so many stories that I have heard from patients, like the daughter who brings in the mother who will not go
in public, anywhere in public.
She doesn't want to go anywhere, but she wouldn't even come to the family, Thanksgiving dinner and what have you, because she's leaking all the time.
And she was afraid that she smelled like urine, and so she refused to go to any family get-togethers, public outings, anything.
Yeah. And it usually starts where, they are going to events and they're going to family things, and then something happens, or there's an embarrassing, something, and all of a sudden, okay, that's it. I'm not doing that anymore. But again, instead of normalizing this, if we sort of take the bull by the horns and say there's probably a fix for this, and there are all kinds of fixes that we will get into, but the biggest problem is most people don't realize how easy the fix can be.
Yes.
I mean, if everyone out there understood they could just sit on a chair for about a half hour, not painful, whatever, read, watch TV.
Not awkward either, like some of the other devices out there.
Not at all. And have a wonderful improvement. Now, if you are changing pads 5 times a day, the chair may or may not eliminate 100% of that problem. But the studies really indicated that there was 95% overall happiness from the patient. And, I don't recall exactly how they defined it, but if someone goes from 5 pads a day to 1, I can assure you they're probably pretty happy about it.
Well, let's talk about some of the statistics, just starting with the first one. 68% of women between the ages of 42 and 64 have some kind of leakage every week. Every week.
Yeah. It's I think the numbers, and when we did research on this, it was a little different. The numbers were a little different depending on who you went to and looked at, but none of them were good. It was like, whoa, how is it this many people are affected on a daily basis?
Well, 40 million plus women use absorbing pads or adult diapers.
Right.
40 million women are just saying, you know what, I'm just going to go ahead and use the diapers and the pads.
And what does that mean for companies like Procter and Gamble and the whole market? It represents $26 billion a year.
So the adult diaper industry brings in $26 billion a year, which, if anybody has watched any TV show at nighttime at all, you always see at least one commercial, if not multiple ones, talking about the different kinds that are out there, the slim fitting. Nobody will know that you have it on. I mean, wouldn't it be nicer just not to wear one?
It's become such big business, and it's become bigger because they are marketing it and they are promoting it and they're saying it pretty much that's normal.
Yep.
And your way to solve the problem is to buy their pads or their diapers, their adult diapers. They look at it being about a 48% growth per year.
Yeah.
I mean, you start thinking about that. That statistically is insane.
Yeah, meaning they're going to go from a $26 billion industry to a $39 roughly $billion industry versus how much are baby diapers growing in that same?
Yeah, so the baby diaper is 2.6% growth.
So adult diapers are going to grow by 48% and baby diapers are going to grow by 2.6.
It's something, and so, where are they putting the money? Are they advertising baby diapers from, 5 p.m. to 7 p.m.? No. That's not it. I mean, you almost never see that.
No.
But at the same time, like Ann said, there'll be one or two ads, Kimberly Clark, Procter & Gamble, someone who makes that will have ads out for adult diapers. And obviously, that's where the money is.
Yeah.
And, a little research showed that you can go to Walmart and buy an adult diaper, and it's $1 each.
Yep.
You buy an infant diaper, and it's something like,
18 cents.
18 cents.
Yeah.
And so, again, follow the money.
Yeah, they're smart.
They're very, very smart, very clever about this. And so the problem is really, really big. And they actually Kimberly Clark and Procter & Gamble believe that 1 in 3 adults, which is 80% women, have bladder control issues based on Urology Care Foundation data.
Yeah.
1 in 3.
Yep.
And so it may start out as just a little dribble, and not like, okay, this is not a big deal.
Well, like the maybe only when I sneeze a little bit and I have to cross my legs, maybe only when I laugh or only when I'm running and I can deal with it at those times. But then it progresses into severity where we had that lady who it was just leaking all the time, regardless of what she was doing. And she did not want to go out in public. And so my biggest thing for people is beginning to talk about it. It's, we did a podcast before on vaginal rejuvenation, which incontinence falls into that. And it's the same thing. Women don't want to talk about this with each other. And I mean, I kind of get it. Do you really want to have a conversation with your friends? Like, I'm peeing my pants. Are you peeing your pants? Like, what are we going to do about this? But you shouldn't be afraid to talk to your doctor. So when you are in your doctor's office, especially OBGYN, you are in a safe place. They're not going to discuss it with anybody else. And they're not going to make fun of you. That's the place that you should be asking them, what can I do? Now, our goal is to get more information out there so that more people are aware that Emsella is an option. So if you are mild to moderate, you can choose the Emsella, because what happens when you get severe, Larry? What are your options?
Well, you're looking at the sling.
Which we've also seen a lot of commercials on that, haven't we?
Yes.
Lawsuit ones.
But there's also, there are just thousands and thousands of lawsuits. You're looking at medications, $2,000 to $3,000 a year, sometimes in cost to deal with this complex. It's not actually simple. It's a little complex. It's how much urine. It's how often urine.
Yeah.
It is, what is the stream like? It's actually involved when you go to the urologist and they start doing their testing. When you're done urinating, how much urine is still left in the bladder. They actually have medications for that. So all of this is being analyzed and looked at. So there are other methods. But if you think about it and you keep it really simple, when something like this starts, and it can start at age 16 or 17.
Yeah, it can start after that first baby pops out.
Yeah, or no baby. I mean, we've had people in here that are very young, and I think it's the whole idea is how do you treat this? And what I've started doing in my consults is that if you're in our office and we're doing a face consult or a body consult on you and coming up with some program, I automatically include it for free. And you don't have to tell me if you have incontinence or not. Pelvic floor muscles need to be re-educated. It's a degradation over time. They lose their function. They forget how to do what they are supposed to do. And the chair literally rebuilds and re-educates those muscles so that you don't have that problem. Well, rather than, not doing anything, and I would much rather you just sit on the chair for free, and whether you have incontinence or not, because we know that there is a statistically very high probability that if you don't have it now, you will have it. Well, why go through that?
And on top of it, so your options are you get a surgery with a bladder sling, which unfortunately, if you have let yourself get to the point of being severe, that might be your only option. Your other option is taking medications that are going to cost you anywhere from $2,000 to $3,000 a year and have some nasty side effects that sometimes make it to where women can't take it. A third option is if you fall into that mild to moderate category and you start now, doing a series of 6 Emsella treatments runs $2,400. So $2,400 for your 6 series and you're done. Occasionally, if women have severe issues, they may have to come back again, do one here or there. But typically, if you commit to the 6, it will get you repaired from what there is. And especially if it's from childbirth, unless you're planning to have more babies, you're never going to be back to the level of severity that you started at. So you're looking at more of a one-time fee with a much lower cost. You're going to have 0 side effects. You're actually going to have extra benefits from it that we haven't even talked about yet. There's no pain, there's no downtime, there's no discomfort, there's no humiliation. And, your fourth option is just giving up and buying adult diapers and, starting to feed that $26 billion, not million, billion-dollar industry where now you're figuring out what outfit am I going to wear tonight that's not going to show my pad. So it's like between those 4, if you're in mild to moderate, for me, it's kind of a no-brainer. Why wouldn't you just figure out a way that I'm going to build this into my budget, sit on the chair, repair it, and I'm going to take care of it from there?
Yeah, and they've actually done studies to look at those taking medications, and 80% of the people that go the route of medications usually stop after 1 year.
Yep.
Due to the high cost of the medications and the side effects. So, the options aren't that good. You really don't have a lot of great options where if you can sit on a chair and again, not have any pain in the process and just do this and it improves the situation quite a bit, hey, why not do that? And the other thing with it too is that the chair actually has other side benefits.
Yes, it does. Tell us about this, Larry. What are these other side benefits?
There's more than one protocol. So there is Protocol 1 and Protocol 2. Protocol 1 is really looking at just directly affecting incontinence. Protocol 2 has actually changed the way the energy is delivered and the way the contractions are done to increase blood flow to the vagina and the entire surrounding area. So the thing that we know in aesthetics is that if there is more blood flow, you heal faster. If there's more blood flow, things go well, no matter what the situation. And so, of course, if you haven't been doing Kegels and you don't have all of that normal activity, by doing this, what's happening? Well, not only is the pelvic floor becoming much stronger and allows you to do more, but it's also increasing the sensitivity because of all the blood flow.
Yeah.
And so there are, reports from women that they feel like sexually there has been an enhancement. And
So we call it improvement in sexual function.
that's right. So the whole women health, that falls into that.
It does.
And so, it's just a general category that, can involve a lot of different types of treatments. But I think for this, wow, what a benefit.
Well, and, this is going to round us into that next part, but women a lot of times don't think about, like increased blood flow is going to help the tissue. I guarantee you this is on the forefront of every man's mind, that if, their area is lacking blood flow, they're going to have issues down there, because one of the top drugs on the market for erectile dysfunction is all about increasing blood flow to the area. So women don't really think about it as the lack of blood flow to the area decreasing their sexual function, but men do.
They do. Like 24/7.
So how does this benefit men, Larry?
Well, so it's like where to start. From adolescence on, you wake up every day with an erection. So, you know it when you wake up. Your hand goes down there and you feel Richard, and sure enough, Richard is erect and standing at attention. It's good, good to go. And this happens every day of your life until the day it doesn't happen. And it's like, what the hell? Richard, wake up. What's going on? And he disappeared, and so the thing is, this isn't a correction for ED. However, there is absolute benefit. Mm-hmm. And speaking as an older guy, I can tell you there is benefit. So, if I sit on the chair, just every once in a while, sit on the chair, Richard is back. And it's very exciting, because when something is every day in your life and then all of a sudden it's gone, it's like, okay, just one more thing being taken away, that sort of thing. Well, just like for the woman, increased blood flow, well, to the man as well. Yeah. And so you absolutely increase sensitivity and you increase different things, and that helps also. And that's in protocol 2 of the chair. And no one is promising that this is correcting ED. That's not what it is. But it might be the first step.
Yeah, and it can be a chance to help you. If a lack of blood flow is an issue and you're doing things to increase the blood flow, it may not completely correct the problem, but it can significantly reduce it. And it may not work for all men. Again, that's a whole nother topic where there's so many things to go into it. And the funny part is, the part that men don't even think about is how often they get up to pee at night. It can completely take care of that issue, which they don't care about that. They just want Richard to work.
Well, I care about that. So I had the misfortune of going over a cliff in a sports car when I was 18. And
he wasn't driving, so it was not his fault.
It was not my fault. And the as part of the injury was ripping up my bladder. So I know that my bladder is small, and we call it a walnut. The walnut is shrunk. Mm-hmm. And I think the walnut keeps getting smaller and smaller because I have to pee more often. So it's what a pain, It's and then you go, and of course, as you get older, you pee slow. So I have to go more often, and I go slow. So it's like, what is this? It's not fair. I find by sitting on the chair, I don't have to get up at night so frequently. Mm-hmm. And there is a muscle, there's a sphincter muscle that on the other side of the prostate, and I believe that it's actually helping that muscle. And so, even though, my walnut is smaller than most guys' bladders.
I was going to say, you better specify on that, because it's going to sound extra strange.
I didn't want to stop right there. I knew where you were going to go.
He's talking about his bladder, ladies and gentlemen.
Yes.
Only the bladder.
The bladder. Yeah, Richard is back, remember? So...
but it's funny, men don't think about it. And, you know, I've talked to multiple men that I know that have done the chair, and some of them have said that they do not have to get up and pee at all during the night anymore, which that's not why they did it. That was their extra benefit. But it affects men. Women, we see about it is we laugh, we pee, we sneeze, we pee, we run, we pee. Men are being affected by urinary incontinence in a different way, where it's constantly waking them up at night, or they have to make sure they stop drinking water by a certain time, or they're going to have to get up 2 to 3 times that night, and it's going to disrupt their sleep, which if you're disrupting your sleep, that ages you in so many ways. So it does affect men as well as it does women. It's just, you know, getting it out there.
And so, you know, I think to kind of wrap it up, if you think about all the issues that we've talked about, and you think about that there is an option that is an easy option, and that it not only helps either improve the incontinence scenario or completely eliminate it, and the byproduct might be enhancement of sensitivity for sex. I mean, that's just a win-win situation. And it is so worth it as compared to the other options. I mean, it's just sitting on a chair, that no pain, easy. And the protocol is 6 treatments, 2 a week for 3 weeks.
Yep.
And, you know, I mean, if it turns out to be a little bit different than that, that's okay.
Yeah.
And sometimes we have patients that, well, they've done 6 and then, you know, they come back for, you know, some Jeuveau or something. And while they're there, hey, can I get on the chair?
Yeah.
Yes, of course you can get on the chair, you know, just as an enhancement. So you can continue to improve whatever, you know, the bladder, the muscle that affects it, you know, the sensitivity by doing that. And again, it's just 30 minutes of time. So we highly recommend it. And we need to get the word out more and more on this. And so we're doing our best that every patient that comes in our office one way or the other, you know, sits on the chair.
Yes.
I don't think that chair should ever be sitting idle.
Yes.
There should be a butt on that chair all the time. You know, I mean, why would we not do that when it is so beneficial to both men and women? I just think it's very worth it.
Yep. Well, before we wrap up, the last thing that I'm going to say is, you know, women need to be more willing to talk about this with each other, or at least with their doctor. Like, you shouldn't be afraid to ask questions. You shouldn't be afraid to say, hey, I'm having this issue. The normalization of having problems as you get older is such a big issue among women, where they're just like, oh, this is normal. This is the way it is. They don't want to talk about it. So my thing is if you know you're having it, other people are probably having it too. There's easy ways to deal with it. Just don't be embarrassed about it. In worst case scenario, talk to your doctor, or, you know, especially if you're in the aesthetics world in this type of thing, you may have a nurse or somebody that you're speaking to as well. We have ways to help you that are easy, no downtime, no embarrassment, no pain. So take advantage of it. All right. Any last words of advice, Larry, before we wrap up?
0.
All right. Well, thank you all for joining us today. We will see you next time.